The next question is very important. What is the relation between ASD and psychosis? Now, I did my clinical training in London in the mid-1970s, at the time of the big psychiatric institutions. And I did my training on some of the back wards. And there were patients there, adults, who were diagnosed with atypical schizophrenia. They were actually Asperger's syndrome. They had what we call in English a mental breakdown, a nervous breakdown. They couldn't cope. They needed help. A psychiatrist would see them, but would be trained in schizophrenia and psychosis and see many of the signs of psychosis. But also, autism was originally called childhood schizophrenia or childhood psychosis. So there would be common ground for diagnosis. And so in years gone by, many people were misdiagnosed as having schizophrenia or psychosis when they actually have Asperger's syndrome. And still today, I have individuals. 2 weeks ago, I saw a 7-year-old girl who was referred for possible schizophrenia or psychosis because she was hallucinating. Actually, she had vivid imagination, and her imagination included having a magic carpet that she could sit on and go to other countries. She would have imaginary friends and an imaginary world. For her, reality does not welcome her. She feels rejected by her peers, but she's intelligent and she has good imagination. So she escapes into imagination, but because she has Asperger's, she doesn't realize the effect it has on other people, that when she talks to her imaginary friends, that they think she's mad. No, it's just imagination. But I want to go through this in a little bit more detail because it is so important, especially in terms of treatment and understanding. In schizophrenia, there can be a sense of paranoia. Actually, in Asperger's, this can be true. They've been bullied and teased, and people do talk maliciously about them. And their impaired theory of mind means that often they assume malicious intent when it was accidental, because they've had so many bad experiences. Another is to escape into a fantasy life, which is a way of coping with reality. It's not a disturbance of reality, it's finding reality doesn't accept me. Also vocalizing thoughts, disengaging your mind from your mouth. Many with Asperger say, my thought process is clearer and sharper if I talk aloud. So it's a way of enhancing learning, but again, not realizing that other people think you're mad because you talk to yourself when it just helps thinking. Another factor, in autism and Asperger's syndrome, you can have very intense emotions, anxiety and depression. And anxiety and depression are on the opposite end of the scale of logic. And so when you have intense anxiety and depression, you can get a disturbance of reality, what we call a mood congruent delusion. The emotion is so intense, reality disintegrates. But then the treatment is to treat anxiety or depression, and once that is reduced, then the delusions diminish. There can be delusions of grandeur. This is where the person with Asperger's syndrome finds that they're not valued in life, and to compensate, to feel better, they have almost narcissistic personality disorder and think of themselves as superior to others, and their delusions of grandeur are to comfort themselves for being different. Also the thought disorder. When I did my psychiatric training, the view was in chess, a knight's move in conversation. That's due to the impaired pragmatic aspects of language that occurs within autism spectrum disorders, of not realizing the listener doesn't understand the logic of your conversation. Another component is the process of thinking. Typical people think socially and a conversation. As you're trying to solve a problem, because you're a social conversational person, you have a conversation in your mind. This characteristic for typical kids usually starts at 3 or 4 years old. They internalize an inner conversation. For those with ASD, that may not occur till they're 11, 12, 13 years old. And they say, I have voices in my head. Well, what they really mean is, they're talking to themselves, but their way of explaining it is not precise, and other people then feel it's a sign of schizophrenia. We also have a literal interpretation of, do you hear voices, with the person saying, yes, because they do hear voices and they see colours. But they may not understand when a psychiatrist asks that question. It has a very different meaning. So those are the components within the confusion between schizophrenia and Asperger's syndrome. In general, schizophrenia is more likely to be erroneously diagnosed, an error, by jumping to particular conclusions. It does exist in ASD, and yes, over the years I've seen some with schizophrenia, no doubt of simple schizophrenia, but for various genetic reasons. But I am concerned that those who are trained in psychosis need to be aware of the clinical differences that occur with someone with Asperger's syndrome.